Hey guys, Dr. Josh Jagoda here, and today I'm going to answer one of the common questions I get in my office and at the gym. That is, I heard a pop or click during that injury, and what do I do? What does it mean? And what does that differ from when it comes to an adjustment? So first things first, we have to understand normal ranges of motion and what normal joint anatomy is in order to understand what these pops and clicks are, because they can have big implications with regard to injury status or therapeutic status. So first things first, we have a normal range of motion. So we're going to talk about anatomy of our elbow for now, just as an example. This is an active range of motion. This is its normal range. It goes this way, does some of this and this, but that is our typical active range of motion. Once we get past that active range of motion, we can no longer go any further, but there is still a little bit of what we call joint play. And so somebody who gives a little extra push on it, that is considered a mobilization or some sort of passive range of motion. And that's where you can see there's a little extra give right here in that joint space. So this is the full range of motion of the joint, really from here to here, the active. Here's a little bit of that passive, and this is going to be discussing further. So when we hear a pop and click or a click, when we're talking about anatomy, when we're talking about an adjustment for chiropractic or manipulation, it's called in medical terms, that is when the joint approaches that end range of motion, and then we give a little impulse, and that's where you feel that pop or click. So that's when we stretch out the joint all the way, pop, and that's where we hear or feel that release. That release is actually a release of gases within the synovial fluid. So that is really important because it has its therapeutic benefit. Most joints will have a 15 to 20% increase in range of motion as a result of that, and then it will resume or reabsorb back into the joint space after about 15 to 20 minutes. If for some reason somebody goes a little harder, so I hear in injuries, people fall, hurt, they get the arm twisted or something like that, and they hear a pop. Usually the first pop is not the one that bothers them, but it's the second and third. So that's where we go through this full range of motion, we get to that end range, we get a little overextended, which is not bad yet, but it's not going into the correct direction of the angle for therapeutic reasons. But then we start to approach what we call that elastic barrier. Before that manipulation, we get that first pop, that's okay, and then we start to get to the anatomical limit, if you see over here. So once we start hearing pop, 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 and then all these extra clicks, that's when you're really risking what we call joint injury or joint damage. So when you start hearing one pop or so, and it's not associated with pain, usually it's okay, typically. But secondly, if you do start to feel more pops and clicks, you have reached the anatomical limit and you're now suffering some joint injury and some pain and discomfort. The reason that you may be having more pops and clicks is because the synovial fluid is getting extended further and further and further. So there's more pops and clicks. There could be tendon snapping, there could be ligament rupture, and there can also be fractures of the bone. And I've even heard where somebody came down and broke an ankle, and you've sure heard that before, and it is possible to hear a snap or a click. But those are typically the common questions I get in the gym, and hopefully that clears up what it means when you have some sort of joint popping or joint clicking in regard to an injury. Alright guys, thanks again for stopping by. I will see you next week.
Yeah.